the News Channel 5 network, this is MorningLine with Nick Barris.
Sounds good.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here on a Thursday. I hope you're having a good morning. It is cold out there again, so just don't even head out. Just stay in and join in the conversation. We have a good show this morning. It may affect you. If it doesn't you, it may well affect someone you know, a family member or loved one, as we talk about health care and maybe adjusting the type of plan you're on. As you see the phone number up there, and the topic this morning is Affordable Care Enrollment. Every year now under the Affordable Care Act, you have open enrollment from November to December 15th. And, you know, there's some 200,000 Tennesseans that are enrolled in this and get their health insurance this way. And now's the time where many of you can either re-enroll with what you're in, and I'll ask our guests about whether you have to re-enroll if you're happy with what you have, or perhaps look now that there are probably some new options out there, maybe find something that's either more affordable for you or more closely suits what your needs are if maybe your condition has changed and you need some other kind of care with that. Anyway, it can be a complicated process, and there is help out there for people as you go through the process of re-enrolling, and that's why we have certified navigators. I love it. We have two certified navigators with us from the Get Covered Tennessee program, and Mary Moore is with us. Good morning to you, Mary.
Good morning, Nick. Thank you for having us.
And you brought Emily Fauché along with
Yes.
you. Not Fawcett.
No,
Fauché. Emily Fauché, both of you are certified navigators. Just tell folks again what a certified navigator is and how they can access you.
So the navigators have gone through, there's a federal training, there's Centers for Medicare and Medicaid Services. That's who we receive our funding from.
Okay.
So we go through a federal training, and then we also are registered with the State Department of Commerce and Insurance, similarly to how insurance agents are registered. And we have to do continuing education every year to keep our registration.
Yeah.
Essentially, I like to explain it as we're not-for-profit insurance agents.
Okay.
So we help people sit down, look at their options on the marketplace, but we're completely unbiased. We don't receive any type
You're
of...
not pushing one plan over another. You're basically going to look at what someone who, and by the way, they access you by phone, they can come meet with you in person. What's the best way to do that?
Yes, so we have both. We have in-person appointments available in several parts of the state, and then we also help people by phone if there's no in-person assistance where they are.
Okay, we'll get the number up, but the bottom line on that, and it's terrific. I'm fortunate enough to have insurance here at News Channel 5, but if I was doing this, I would definitely seek you guys out for help. And the idea is, and we'll, again, as I said, have the number up there, but you call, and so what you two do then with an individual is probably ask them their background, what's your situation, what do you need, and then you can kind of show them the various plans that might serve their needs, correct?
Yeah, so as Mary said, we're unbiased, so we can't, we always get everyone that asks, you know, okay, which one should I pick?
Right.
But we can't, you know, we can't say we can help them discuss what their healthcare needs are and what it would cost them on different plans and whether certain plans would cover the access that they need, but we wouldn't sit there and tell them which plan to choose.
Right. You give them the options, they make the choice, and that's the way it should be. But you can. The key though is you guide them through the process. Now, by the way, if you're on a plan now and you're happy with it, do you have to re-enroll this time of year, or does it automatically roll over?
So there is automatic re-enrollment, and this is actually the first year where we haven't had any carriers leave the marketplace.
Okay.
So everyone truly can keep their plan this year if
Sometimes
they want
you would
to.
have no choice if they left, right?
Exactly.
That's what you're saying, yeah.
But we do always recommend people to actually go back through and update their application, because people's income change from year to year. Their household situation might change, their health needs might change. So it's a really good idea to go in and update their information to make sure that they're getting the level of assistance that's appropriate for their current situation.
Makes perfect sense. So you said none left, but apparently several have joined.
Yes.
How many plans are there to choose from?
Well, there's 5 insurance carriers
okay.
or insurance companies to choose from this year.
How many were there last year?
Well, we had 2 join.
2 join. So there were 3 last year?
Yeah.
So now you've got 5, and each of them have a variety of different options. Is that right?
Yes.
That you can get into. So there's more options, and state by state can vary in terms of costs?
Yes, very much so.
How so? Based on what the state provides, or why is it different?
So it's just that every market is different. This year was the first year since the marketplace has been open that nationwide insurance premiums decreased. So this is the first year we actually saw a downward trend in insurance.
Do we know why
premiums
that? What drove
decrease.
that? Any idea?
Increased competition,
Okay.
I would say.
Competition's great.
I think initially, some of the insurance companies that were on the marketplace experienced some losses because they underestimated the high medical needs of people who were coming on the first year. Because a lot of people who were, ready to sign up the first year, the first open enrollment, were folks who had high medical needs and hadn't been able to get insurance because they had pre-existing conditions.
Right.
So there were a lot of people getting insurance for the first time who had been putting off surgeries, procedures, testing. So initially some of the insurance companies experienced losses, but I think at this point they've stabilized. The people who are signing up year after year, they're in better health now. And so the insurance companies have been able to adjust their pricing to reflect that.
Okay.
And then Tennessee actually had the largest decrease of any state.
Which means it's a little more affordable here then.
It is. Now, because so many of our consumers, like 80% of people who are on the marketplace in Tennessee, receive some type of financial assistance to help them pay for their premiums. So regardless of the full price of the premiums, the financial assistance they receive kind of buffers them from that.
Gotcha.
It's similar to a FAFSA. If you've ever helped anyone fill out a FAFSA.
Yep. Oh, yeah.
The government kind of comes up with what the estimated family contribution is.
Yeah, you're talking about the financial aid forms.
Yes.
Yeah, my son just did that at UT. So
exactly.
That was,
It's a very similar process. It's not as complicated, but it's based on the family's size and their income. The government has a actuarial table of how much could this family afford to spend each year on their insurance.
Right.
And then whatever the difference is between that number and the full price of the premium is made up with financial assistance.
I see.
So the full prices are going down, which is great. But for a lot of people, their insurance is staying the same. And if they want to keep their current plan, they may even actually have to pay more.
Okay.
Because of the way the financial assistance works. So when the full price goes down, the financial assistance actually decreases too.
Makes sense. All right. Now, I know a lot of people are going to be watching. I imagine several people watching maybe are on the Affordable Care Plan, and they're thinking about it. There may be others that aren't, but could consider it. I guess I'm wondering now. For instance, for me, let's just say, for example, I can't leave my health plan here at News Channel 5 because I think I can get a better deal because I have it available to me from my employer. This is exclusively for those maybe perhaps who are self-employed or have no insurance, correct?
Exactly. So it's for people, it's really for people who don't have any other option for insurance. If you have workplace insurance, you're usually not eligible for the Affordable Care Act. If you're eligible for Medicaid or Medicare, also you're not eligible for the Affordable Care Act. So it really is there for people who are self-employed or maybe hold 2 part-time jobs or have some other way where they're, or a contractor, someone who doesn't have insurance through their work.
Okay, and so the bottom line on this, I'm wondering, as open enrollment comes along, and we're going to take a break in a moment, and we'll take some calls, but what do you deal with the most with your callers? What are the questions most people are wondering about when they call you? Just what else is out there? Are they just confused about the process for signing up? I'm just curious what you deal with most. Or is it just wide range?
I mean, it definitely varies on the person's situation, but I think a lot of people who are coming back this year, they're concerned with, can they keep their plan? Is it going to be the same price?
They still have the different tiers of plan. Could someone, if somehow they had, let's just say it was a self-employed person who's making $500,000 a year, and they want to get insurance, and they could, right?
Yes.
And they wanted to get the gold standard, which means it covers everything, and there's no deductible. You could do that.
They do have gold level plans. Some of them still have small deductible. Some of them, they might still have a deductible, but it's going to be more comprehensive coverage. So yeah, so that's a good point. I'm glad you brought that up. There's no upper income limit on signing up for the marketplace. There is a limit on who gets financial assistance to help them, but anyone can go on and pay full price if they want. And sometimes people who are like laid off or they're in between jobs and they're on COBRA, we really encourage them to look on the marketplace because COBRA can be so high.
Yeah, it's spendy.
And especially if they're in between jobs, so maybe their income's going to be a little bit less for this coming up year, or even if they still have some type of income coming in, the marketplace could be a more affordable option. Is
it fair for me to ask you just ballpark, and I know everyone's different, but what is a typical premium for some? I mean, how expensive can it be? And I'm thinking about the normal average middle-class American who's in the category that would qualify for, choosing to go on the Affordable Care Act is what could it be? What range?
And actually, I'm glad you asked that.
I'm not talking about the $500,000 earner. I'm talking about
one of the most common questions we get.
I know, and it's probably impossible to answer accurately, but you can give a range, low end to high end within reasonable, and it all depends then on the level of care you get, right, or coverage you get.
It does. So a lot of people, if they're close, and Emily can probably speak to this too, but if they're close to the poverty level, a lot of people can get plans for $0.
Okay, so there are some who are really, really indigent that can get some type of coverage for next to nothing.
Yes.
Okay.
But then there's also people who, for a single person, maybe early 30s, they, middle income, they might be looking at $200 a month.
And that would cover doctor's visits. If you had appendicitis, there would be deductibles, things like that.
So the great thing about the marketplace is all of the plans are required to cover the same set of services. So they all have prescription coverage, they all have emergency coverage, they all have doctor visit coverage, but the level at which they're covered is the difference.
When you say level, how much you pay out of your pocket? And is it copay, or is it deductible, or what is it?
There's some plans that are just deductible and then co-insurance. So the consumer has to meet their deductible before the insurance kicks in at all. So there's not like $25 when you go to the doctor copay. It's just you pay the full price until the deductible, and then after that you pay a percentage, 20%.
That's what we got at here at Channel 5.
50%.
Well, you have different plans, but that's the plan I'm on. I've got a deductible that I have to until I meet that. Then I pay out of my pocket for everything, but it's a certain level, and then after that you get the majority covered, and you're right, there's still
70,
a percentage.
30, 80, 20, they're all different.
Some things are 100%.
And some plans do have copays for things like doctor's visits. Some even have specialist visit copays and prescription copays. And then the one thing that's really important to know about all the plans, regardless, is all of them cover preventative care services free of charge. So your yearly physical, for women, your yearly well woman
most
visit.
Insurance plans, isn't it?
Mammograms,
colonoscopies, things like that.
Yes, all of those are going to be free of charge on any plan that you choose.
Which is great. All right, listen, we'll take a break on that. We can take some phone calls, 737-7587, and maybe we can get into more of the nuts and bolts of some of the plans and what's new out there that's available. Because to me, if I was in that situation, I think it'd be exciting to explore what is new, and with the hope of maybe finding something that's more closely tailored to exactly what I need, and maybe even saving me some money. So we'll take a break, and truly, if you're there in that situation, you have a question or comment, give us a call. The number 737-7587. More right after this.
No